Hello. Today we are going to discuss about measles. There has been a recent rise in measles cases in UK from December 2023, and it's spread when an infected person coughs or sneezes. It can spread very easily. So you can protect your child by making sure that they got 2 doses of MMR vaccine. Normally, first one is given in 12 month of time, and second one 3 years 5 months old. Even if you and your child miss the vaccine, it is not too late to get it. So you can give it whenever you want. If your child has had 2 doses of MMR, almost no chance of getting unwell with measles. Um, so unless they have a weak immune system. So basically, we have to see that what are the symptoms of the measles. It starts with fever, red, sore, watery eyes, runny nose, cough. After a few days, there is small white patch appears inside the mouth and the back of the lip, and rash that starts on the face, behind the ear, then spread all over the body. Spots of measles rash are sometimes raised, often joined together to make up blotchy patches. They're not usually itchy, and rash looks brown or red on white skin. It is difficult to see in brown or black skin. So you need to know about what are the concerning features when you have to take to emergency. So if your child has following features like breathing too fast, breathless, or it is the child is not able to eat or drink, working hard to breathe, breathing stops or pauses, pale blue mottled, feel unusually cold to touch, difficult to wake up, weak high pitched cry or cannot be settled, has a fit means seizure, has a rash that does not go away with pressure, and in under 3 years, 3 months old, temperature more than 38 degree or under 36 degree. So you have to take to hospital emergency, or in NHS area, you can call 999. And now all these features I mentioned if not there, but still some of the features like child is breathing faster, working a bit hard to breathe, dry skin, lips and tongue, not had wee or wet nappy for last 8 hours, poor feeding in babies, less than half of this usual volume, irritable, and not, you cannot settle them with toys, TV, food, hugging, even after when fever comes down, and in 3 to 6 month old, temperature of 39 or above, and temperature 38 or above for more than 5 days, temperature less than 36 degree in those over 3 months, getting worse, or you are worried about them, then you need to contact your GP surgery or NHS area 111. And if any of the time any worsening feature that appears I mentioned before, you have to go to the emergency. Now whatever I mentioned, if none of them are present, then you can watch them closely, and of course you have to look for red and amber symptoms that I mentioned. And if child has other symptom associated with their fever, you may want to look at the informations like sore throat, cough, earache, diarrhea, vomiting, tummy ache, all these things. And you can have a look. Additional also advice available to young families for coping with crying of well babies. So you can continue to provide child's care at home, but if anytime you are concerned, you can speak to your health visitor or local pharmacist, or even you call NHS 11 number. And if anytime you think any of the red or amber feature appears, you have to go to the emergency. I will in the next time I will discuss about what you should do in this situation. So bye for today.